If you take care of a loved one and they happen to be a senior citizen, one of the primary concerns you probably have is to make sure that they do not take a fall in your home or their home. Naturally, for a lot of us, we want the best for a loved one. And we're talking about that today, fall prevention. We're going to be doing that with Mr. Terry Love. He is the Injury Prevention Manager with the Tennessee Department of Health. So nice to have you here today, Terry.
Thanks for having me.
For folks who don't know, Falls Prevention Day actually happens on the first day of fall this year, and this is going to be the 8th annual Falls Awareness Day. Tell us the importance of it.
Falls Prevention Day is the beginning, or the kind of the start of awareness for seniors and everyone around falls in the home. And this is an event that has been coordinated by the National Council on Aging for 8 years. And it's one of many fall prevention activities we do here in Tennessee.
Yeah. Something that folks might not know, every 13 seconds, a senior citizen is actually treated in the ER because of a fall. This is kind of a alarming statistic. When you think about 13 seconds, you might think every 13 minutes, but there's even more statistics that you can share with us that, people need to consider.
National statistics show about 1 of 3 adults over 65 fall each year. And many of us fall.
Sure.
All age groups fall, but those older adults are most at risk for falls. There are hundreds of emergency room visits in Tennessee, and there are actually fatalities due to falls. In 2012, I think we had 500 fatalities due to falls, which is the most tragic thing that can happen as a result of a fall.
Sure. Do you all look at aging as the primary reason why people do fall? I mean, is it a lack of balance or mobility that they start to
Well, as we age, our body changes, and we tend to get more sedentary as we age, and that is a major risk factor for falls. If adults are not exercising, doing weight-bearing exercising, balance exercises, they put themselves more at risk for falls. And then one of the kind of a snowball effect, if a senior has a fall, then they become afraid to do activities, and that makes them more sedentary. They move less, and they're more likely to fall. Or they may not be willing to talk to their healthcare provider when they fall because they're afraid if they tell someone, they might lose some independence. And this is actually counterintuitive. I would urge people to talk to your healthcare provider, even if you haven't fallen. Ask your health care provider for a medication review. Go to the eye doctor, have your glasses checked, clean your glasses. These are all things that seniors can do to help create conditions where they are less likely to fall.
Great information and great advice, actually. If you are taking care of a loved one, sometimes that's a hard conversation to have.
Sure.
What do you suggest, Terry, of how people go about having that conversation or starting it with their loved one about falls?
Well, I would say be open and honest and explain to them that you care about them and that this is a serious issue. And chances are, if they're over 65, they've already fallen. And so they are probably open to discussion, more open than you think.
Sure.
And anything that you can do to help them get the resources to manage falls would be also helpful.
All right. You talked about seniors possibly getting their eyes examined, making sure that that's okay, or cleaning their glasses, things like that. What are some other things they should be thinking about when we're talking about prevention, fall prevention?
Well, the first thing is to declutter the home, light the home, using night lights, grab bars, getting that favorite rug that you got for Christmas 10 years ago and putting it out of the way because it's a fall hazard. Being mindful of pets. Pets are a big risk for falls. Also, sweeping leaves away from sidewalks. Wet leaves equal ice. They're very slick. Minor home repairs that you've neglected over the years, a sidewalk crack here, a light out in a closet, those kind of things are very important for seniors to focus on.
Yeah, and obviously, again, if you are taking care of somebody, going into that home and kind of assessing it is
Sure.
probably a good idea.
And people can contact us. They can email me at terrence.love@tn.gov. I'd be glad to forward them documents, files that would show them how to do a quick home assessment for safety. Or they can call at 615-532-7778. I'd be glad to visit with someone. There are multiple resources in their senior centers, in their doctor's offices, the YMCA. I would encourage folks to reach out and do prevention in their own homes.
All right. Obviously, the state of Tennessee is doing what they can to raise awareness both the personal and the financial tolls of falls. But what else is the state doing, I guess, to promote fall awareness?
Well, we actually have fall prevention classes that seniors can take. We trained 38 Stepping On leaders. Stepping On is a evidence-based fall prevention program. It's a 7-session program that's held typically in a senior center or a community center. It's in groups of seniors. It's story-based. We have experts come in. We do very simple exercises for seniors. These are for seniors who are still living independently, and I would love to speak with someone if they're interested in hosting a Stepping On class with our trained leaders, or receiving training if they want to become a leader, or if they are interested just in attending the classes.
So obviously September is a great time to
Sure.
make people aware of falls prevention, but at the same time, this is year-round awareness.
Yeah, prevention is like brushing your teeth. You do it every day, all year long, and if you're really good, you floss. And so, awareness, prevention is not accomplished with one event, but that sometimes sparks people to make a change.
Sure.
So that's why we really support the Falls Prevention Day on September 23rd, and then we would love to connect with folks and then encourage them to join our other programs.
Okay, and Terry, if there's one important thing that you would get out to folks who are watching this, what would you say would be the most important thing, a takeaway, if you will?
If they think they have an issue with falls, talk to their healthcare provider. That's a great start. That would be probably the biggest piece of advice I would ask them to do.
All right, Terry Love with the Tennessee Department of Health, thank you so much for your time today. We really
Thank you.
appreciate it. Great information.